My name is Dr Susanna Banerjee. I am the ESMO Resilience Task Force Chair and the ESMO Director of Membership. As hopefully you're aware, the ESMO Resilience Task Force collaboration has launched its first survey looking at how oncology professionals are reacting to the outbreak and the challenges. Well-being is fundamental so that we can ensure that we deliver the best care for our patients now during COVID-19 and beyond. It's my pleasure to introduce the second video of a series of interviews that we've been doing on this very topic. And I'm very pleased to introduce you to Dr Jon Lim. He is a member of the Resilience Task Force Survey and also a member of the Young Oncologists Committee for ESMO. We spoke on the other video with John Hannon about how COVID-19 has been affecting current daily practice. And what I'd like to ask you is whether you feel able to deliver the same standard of care that you were previously during this COVID-19 outbreak.
Well, Susie, first of all, it's a pleasure to be here and thanks for the invitation. I think from the perspective of the big picture, the short answer is no. We unfortunately are not able as oncologists to deliver anti-cancer therapies to patients we would have otherwise wanted to treat in the absence of COVID-19. What I'm really struggling with the most is really the communication aspect of the care. As oncologists, we take a lot of pride in delivering difficult news or complex news seriously and empathetically, and that's been really difficult through a face mask and eye shield and maintaining a social distance and sometimes through the phone. So that's been very challenging.
Thank you for sharing your experiences. I agree with what you've said. Personally, I've done a lot of telephone consultations working remotely, very important points, and we have no choice at this current situation. But at this particular point, some countries, some regions around the world are preparing for the next steps beyond this COVID-19 peak in terms of cancer management and going back to a normal or a new normal. So how do you expect to manage cancer patients going forward, say in the next few months?
For me, my thoughts for the future almost change on a daily basis. And the big question is how we navigate anti-cancer therapies for patients who may or may not have COVID. And for even those who test negative, what are we going to do with the testing? And whether we have capacity to test on a regular basis, whether we're confident enough that a negative PCR is good enough to continue treatment. How about those therapies which are focused on immunotherapy or immunomodulating agents? I think all these questions are challenging and difficult, and hopefully with a lot of the big studies and big collaborations that's out there at the moment, we'll get a little bit more information about that.
So we've talked about some of the changes in practice. Do you think that any of the changes in practice or ways of working, which were effectively forced because of COVID-19, should actually remain beyond this crisis period?
I think one big thing for me is the rationalization and streamlining of care. We are really thinking about making everything necessary and essential. And also with the use of IT, like telephone or video clinics, I think that's actually worked better than I had expected. And that saves a lot of time and travel for, especially in the northwest of England, where some patients travel quite far to come to see us in clinic. So I think that's quite nice. This pandemic has really brought out some of the best things about collaborative work. I think, as you know, there's a lot of international collaborations that we've never seen before to tackle some of the most pressing issues that we face. So I think that will be a nice thing to maintain.
What about on a personal level? Could you expand on some of your experiences and potential positives on a personal level during this COVID-19 period?
Susie, it's been quite a sudden break for me, really. Until about March, I've been in the lab in London doing a PhD for the past 18 months, and I've been redeployed back to clinical work. I think on a positive note, I do feel a renewed sense of purpose being a clinician. I think this sudden kind of stop has also allowed me to have the time to really reflect and think about what's important to me in my career and also my personal life. And I think that's been very insightful in going forward.
That's great to hear. Thinking about some positives that we can hang on to going forward is very important, coping with COVID-19. I very much hope that some lessons are remembered post-COVID-19 in the ways that we're working going forward on that note. And as part of the survey, we are looking at suggestions from the respondents of how we can work going forward. So thank you, John, for your honesty and your time in answering these questions and sharing your professional and personal experiences.
Thank you.